what do you tear? You tear?
All right, so we have Dr. Marcy Crouch on this morning. You guys know her as the Down There Doc. I know her as my friend that I've known for a long time, maybe since you were in PT school. I'm not sure. I
Probably.
don't know, maybe, but Dr. Marcy, she is sharing her wisdom with everybody on TikTok and Instagram about how we need to make sure that moms have the good pregnancy and postpartum care that we know that they need. Welcome to the show, Dr. Marcy.
Thank you for having me.
And you've got a podcast too.
I
Tell me about
do.
that.
I love it. It's so fun. It's called No Mama Left Behind, and we started it last summer. So it's been a little bit over a year. And I own it with a colleague and friend of mine, also my work wife. Her name is Allison Hempsey. She is a mental health provider. So
That's awesome.
yeah. So we talk kind of about all the things in motherhood and women's health in terms of like physical and mental. And she's a mom, she has a 2-year-old, and she's pregnant right now with her second. And so we bring a lot of our own experiences to the show and sprinkle in some tips and expertise in terms of like figuring it out.
Yeah.
And all the things that nobody talks about, so it's super fun. She is hysterical. We laugh a lot.
Sounds therapeutic.
Yes, it is. I'm just like, when we don't record for a week or so, I'm like, I miss you. I need
that's
you.
fantastic.
So, yeah,
that's great.
She's great. She's my work wife and she's amazing. So
That's
you should
awesome.
listen.
I have, but I don't think I heard that. I don't think I paid
Oh.
attention to that backstory though.
Yeah,
Like I don't think I realized that. So awesome. Now for you, you went pretty straight into pelvic health. Is that right? And then like what made you do that?
Yeah. So yeah. Great question. Yeah. So I always joke and say that, if somebody asks me a question about like their shoulder or an ankle or a knee, I'm like, I'm like, right? I don't know. I haven't really put my hands on a shoulder in, a long time. But yeah, so I didn't know anything about women's health. I didn't know anything about pelvic floor health or pregnancy or postpartum when I started my doctorate program. I went into PT school thinking I was going to do something completely different. I either wanted to work with the military population coming back from war with blast injuries, or I wanted to do like neuro, or of course what everybody said was like, be a PT for a sports team, like live in the dream. And I never played sports, so I don't know what the fuck I was thinking about that.
That's funny.
Yeah.
That's really
funny, I was like, I'll totally be this like celebrity PT. And I'm like, what's a baseball?
Oh my gosh.
So I'm like,
meanwhile, you're married to a volleyball coach, right?
Correct.
Yes.
Yeah.
Okay.
Meanwhile, I'm married to a jock. 100%. And I'm like, what? Hand-eye coordination? What is that? So anyway, so we had just gotten married and none of my friends were having kids. Kids weren't even on the horizon. I didn't really like kids, to be honest. Like I never babysat. Like the whole world was like not even in my head. And I remember one of our first anatomy classes, our first year, the professor, Susan Sigward, I'll never forget it, was going over pelvic floor and back anatomy. And I was just like staring at these anatomy pictures and I was like, whoa, what the hell is happening right there? And she used the example of a woman who had a very significant tear during childbirth and had years of dysfunction afterwards in terms of pain, incontinence, all of the things. And I remember just like looking at that picture and listening to her talk. And my jaw just like dropped down.
Wow.
And I remember what I was wearing. I remember where I was sitting. I remember it like it was yesterday. It was one of those times in your life that's just like, it's a core memory. It's just like, like burned in there. And I was like, what do you tear? You tear? Like it wasn't even in my wheelhouse. I didn't even know what was happening. And then from that moment on, I was like, holy shit, this is something that's like so needed. If this is happening to so many women, nobody's talking about it. I mean, I was in my 20s. I didn't even know that those group of muscles existed. And I had been working in, in physical therapy and rehab for years, as an aide and doing my volunteer hours and all these different
Just
settings.
didn't talk about it. Yeah.
No, I had no idea.
Yep.
And so that was my first year of grad school. So that's when
Oh,
I
wow.
got involved with, at the time it was called the Section on Women's Health, as a student member. And I got involved kind of with APT on that level. And that's, I think, how you and I met.
Yeah.
And I started doing research and presenting as a student and really kind of advocating at that point. And then I wanted all my rotations to be in women's health. And they're like, you have to diversify.
You have to do other things. Yes. Do that shoulder.
Stupid shoulders. And then, so then that's just, I knew that's what I wanted to do. And that's what I've done.
Wow, that's super cool. And so for you practiced how long in pelvic health before you had your oldest?
Oh, great question. I have to do math. So I graduated in 2010, and then I went right into residency. So I started putting my fingers in vaginas in 2009 because I did it on my last rotation as a third year. So from 2009 to 2000, and let's see, Jonathan was born in 2015.
Okay.
And then Will was born in 2017.
So did you feel like you were prepared going into pregnancy, like as a therapist before it all happened, kind of going into it, or you're like, I got this, this is good, I feel like I have a handle on this?
Yeah, that's a really great question. No.
Okay.
No, I didn't. And I felt that well, first we went through IVF. So we did 5 years of IVF to get Jonathan. And that's like a whole nother.
Right. That's a whole nother podcast.
Yeah, totally. That's a whole nother situation. So I was already like in the infertility world and like dealing with a whole bunch of stuff and complications and all these things. So like I already had like a little bit of, I would say, trauma, like kind of in that area.
Sure.
And then when I got pregnant with Jonathan and it stuck and I was continuing through the pregnancy, you and I in this field, unfortunately, we see things that don't go right.
Yep.
Or women and birthing persons that are having a lot of issues afterwards, right? Like people that don't have problems necessarily or don't have symptoms, like don't come in, right? Like we don't see that. So my whole world was pelvic floor dysfunction. And so I remember talking to my OB when I was like around, 32 weeks or something. And I just had this like moment of panic in the appointment. And I was just like, I don't think I can do this. Like my vagina's going to rip into my asshole.
Oh my
I just was like freaking out because I was like, this is all I see.
Right. That's all you knew.
That's all I knew. Yeah. And so I didn't feel prepared in that sense. Like, what's going to happen. And then I felt this kind of really interesting, I think, dichotomy of like, if I don't have this like textbook birth, like if I have a tear or if I end up with prolapse or if I do medication, like, am I going to be thought of as like a hypocrite or someone that doesn't know what they're doing because she sustained a vaginal tear and like my whole career is on trying to prevent them? So I had like all of this, it was like a very strange time. But it was fine. I mean, I ended up with a tear and a prolapse and all the things. And, what it taught me is that we can prepare for as much as we can. There's things that we can't prepare for. And then we just move forward and we have the team in place to make sure that whatever happens is not something that's going to be kind of the end all be all. And it's taught me that like, there's all this like kind of fear around these diagnoses, right? There's like, oh, you have a prolapse, you can never do this. Or, oh, you have a diastasis, you can never do this.
Right.
Or, oh, you're leaking pee, you can never, blah, blah, blah. But it's like, you can, it's just a matter of like, let's rehab and figure out, how to do it so it's not causing you dysfunction. So it changed the way that I practiced and the way that I taught. Kind of drove the design of my online programs because I've been lucky enough to have the experience of having two kids, coupling that with my training. But I don't know. It was interesting. And both births were completely different. I'm sure with your kids too. Like,
oh, absolutely.
I mean,
I'm sure I've told you, I laminated my first birth plan, which my son still hasn't read.
Laminated. That's totally something I would have done. Hysterical.
No, and looking back now, I just I'm like, who was that person?
Mm.
But I mean, and it's so interesting to hear your perspective where you're like, okay, I'm a biased data set. I only see bad
Mhm.
stuff.
Right. Yeah.
If this happens to me, am I a
Yeah.
fraud?
Right.
That happened to me after the fact, not
Yeah.
before.
Oh,
It
interesting.
it was
Yeah.
more after the fact because I haven't had a vaginal delivery, and so it
Right.
was, okay, do you like, it was almost kind of like, how do you does somebody trust you any less
Right.
because of that? Or are you
Totally.
only going to be known as the C-section person? I'm like, "No."
Interesting.
So it's funny how we process that having,
Mhm.
when this is your day job and this is your
Right.
work, like,
Yeah.
but nobody's looking. I mean, like, I
No
don't
one
think
cares.
anybody, no one gives a shit.
No. And honestly, I think like the struggles that we face personally as
Yeah.
healthcare providers, I think help us in our field because we have that empathy and we have that
Yes.
understanding and we say like we know what it's like. Like
Yeah.
we don't know what you're feeling, but we know what it's like to be in a situation where you feel scared or you feel
Yeah.
overwhelmed or you feel like no one's listening to you or
Yeah.
whatever. I mean, I felt that way with I am like, me. I mean, I'm like a raging feminist, like advocate for women, like scream it from the rooftops. And like, there was a nurse in my first delivery who showed up like right at a crucial moment. And she wasn't in there. I had a 3-hour pushing phase. My baby, like he was not coming out. And
Yeah.
I was pushing really hard for a long time. I was exhausted. I remember like falling asleep and like on the birthing bar in
Oh my
between
gosh.
contraction, like in between pushes. I was crying. I was like, I'm so tired. I mean, it was 24
Yeah.
hours.
Oh,
I was
sure.
barfing for like 12 hours. I had nothing in I just was depleted.
Yeah.
And this nurse comes in and she like wrenches my left leg up and like sticks it into the stirrup or whatever. Never saw her, nothing. And I had this like cramp in my hip and
Ah.
I was like, don't touch my hip. I like yelled at her. And they were like, oh, no, that's the baby. That's the baby. I was like, that's not my baby. That is my labor room. I was like,
You're like, that's my damn nurse.
yeah. I was like, don't fucking touch my hip. And my husband was like, whoa. And like, she put my leg back down and then she left, and I was like, I'm like, people do shit to you that you don't
Yeah.
expect, and I'm like, don't fucking do that. I was like,
Well,
my leg hurts. But anyways.
Well, I mean, it brings up a good point though, that like, I mean, where I live, and you probably understand this with your background in California. I mean, we have a lot of older moms here and a
Yeah.
lot of moms that are like, well, does this physician do this? Does this do this?
Yeah.
And I'm like, look, you're not going to be the person to change their mind or to be able, like, and you're also not going to be in a place where you can sit there in the delivery room and order around all the nurses. Although I was
Right.
trying to be supportive with my, laminated
Yeah.
birth plan. So,
You're like, look, I've made copies for
I,
everyone.
I did. Don't laugh. I thought I
You're
was
like, you can just put it right in your
well,
pocket.
right. And I thought, it's easy cleaning. I thought I was being
Yeah.
very,
You're like, look what I'm doing to help you.
but now like I see that, and having been an older mom twice, like
Mm-hmm.
it's that first time that you don't have full control, and that really
Yeah.
is parenting. I mean, the
Yeah.
second you
It's
conceive, you
true.
kind of lose control. But
Yeah.
I think,
True.
you know, it's such a hard line to walk when you're trying to support a client. I think to be like, okay, you want to be wary of these things, but also
Yeah.
it can turn out to be a decent experience. But it doesn't
Regardless.
define. It doesn't
Yes.
define. It's kind of like getting married, right? Like everybody gets all super excited about the wedding and the
Yeah.
honeymoon, and then they forget you have to be married after that.
Forever. Yeah. I know. Mm-hmm.
Details.
Details. Yeah. Coming up on 15 years in August.
Oh my God. Oh, you're more than we are. We just hit 13. So
Yeah. Yeah. We
yeah.
got married in 2007, right
Yep.
before we started grad school. I started grad school, I should say. Yeah. And I think it's important to note too, just going back on what you were saying, is that I always tell my moms and clients, like, we can have our references and we can
Yeah.
have kind of like, our ideal situation, but I always like to have a plan B, plan C, plan D. And I think the most important thing really isn't like kind of this birth plan, but it's like what happens in those appointments prior to delivery and really understanding the flow of events should something happen.
Mm-hmm.
And so I counsel my moms and clients on like questions to ask their providers about like, okay,
Yes.
so like, when they go in for their 32, 34, 36-week appointment, like you have these things in your mind already. So when it comes, you're not like, oh shit, what's going to like,
Exactly.
oh my God, like now what? Like you kind of like, okay, we talked about this. Like, remember we said that like if X happens, then we're going to do Y, right? So it's not just like in the moment, like scared decision making.
Yep.
So I'm always like, okay. And this is what worked for me too, because I was like, what happens if like, you feel that you need to get the baby out with forceps or, a vacuum? Like I
Right.
would, I'm like, and I told and this was just me personally. I told my physician who I was very close with and worked with at the hospital. I said, if you feel like you have to get instruments out, I was like, take me to C-section. Like
Yeah.
that was my preference, just mine, and
Yeah.
I don't know if that's wrong or right or whatever, but I was like, I would rather have a C-section than you use forceps and like pull a baby out of me, like just
Yeah.
from a pelvic floor standpoint, just my,
Right.
like just me, but like, there are really great physicians out there that use forceps well, blah, blah. But for me,
Yep.
and so she was like, okay. And she's like, I wouldn't. She's like, we're not really cowboys here. We don't like just like bring the forceps out. She's like, there are other things that we can talk about, but I understand that and I'm good with that. And I was like, great. So like I knew in my head moving forward that, if something happened, like she knew my preferences and I knew that I didn't have to make a decision while there was like a baby half
Right.
in, half out. You know what I
Yep.
mean? Like, so if we kind of know these scenarios or the what
Yes.
could happen ahead of time, then we can start to have these conversations with our providers in a situation that's not like, you know, panicky, have to make these
Right.
decisions. And we
Exactly.
started to develop this trust with our physicians and our OBs that they can make these decisions that they're trained to make. I mean, they are the medical expert, like they are
Right.
trained to make these decisions, but where those decisions are going. So it's not like, oh, I don't fucking know what happened,
Yeah, no, that's one that I tell people all the time. Up here, we have some larger physicians groups, and so you might rotate through a group of
Yeah.
5, 6, 7, and that can be frustrating for people. And so I'm like, you know what? You can have this bank of questions. Keep asking the same bank of questions
Yeah. Over and
every
over
time you
again.
go into a different provider. So
Yeah.
you can't make the assumption that everybody's going to have the same answer.
Right.
You need to understand kind of who you're dealing with. And
Mhm.
again, just so that you're at peace with,
Mhm.
at least it's kind of like an awareness sort of thing, like the more you know kind of deal. But
100%. And
yeah,
so many, and I'm sure you've seen this in your career too, that no matter where you practice or us, where no matter where, and we move around a lot. My husband's a coach. We move around a lot. So I've had the opportunity to work in lots of different settings: private pay, cash pay, hospital based, outpatient, like all these things in all these different cities with different populations and different types of cities. And then there's always the same thing that people say, no
yes,
matter where you are. And
yep,
that thing is, nobody told me.
yep,
I wish I would have known.
yep,
Nobody said this could happen. Nobody talked about this in the birthing class. Nobody talked about this afterwards. I wish I would have known. I wish I would have known. So
yeah,
if we are able to say ahead of time, this is what could happen, not to scare them, not to be like, oh my God, like this is so terrifying, but just be
yeah,
like, okay, look, this is what happens to your body from a physiologic standpoint. And here's what's going to happen if that happens. You're going to
yeah,
call me at 2 weeks. You're going to ask doctor these 3 questions. You're going to do these 2 things before you
yep,
get home. And
yep.
then, and if they just know, then it takes all of that
Makes such a difference.
such
Yeah,
a difference.
yeah.
And that's really what
Just
this
to
is
have a
about.
plan. Yeah, and I
Mhm.
think that's where probably plan is probably best used as opposed to a laminated version, more of like a framework per se.
An algorithm.
Right,
Yeah,
exactly.
right. It's like you go choose your own adventure,
So
I think.
what are like maybe what are maybe the top 3 things that women say to you? And you work a lot virtually in group
Yeah.
settings and things like that.
Mhm.
What are the common things that moms say, "Gosh, I'd wish I'd known about ABC."
Yeah. So I think from a birth perspective, I think a lot of them wish they would have known about like medications and side effects. A lot of times they're like, I didn't know I was going to get the shakes. I didn't know I was going to be able to not leave the bed. I
Yeah.
didn't know that I would, have a catheter. I didn't know that I could puke, like kind of all of these things that they don't really say, talk about. Another one that a lot of people tell me is like that first poop, excuse
Yep.
me. in the hospital, like first poop is always, why didn't they tell me that that was going to be like a whole thing? Or like not having sensation of when your bladder is full and just like passively peeing, those first 3 days and not
Yep.
understanding that and knowing that that's a temporary thing, right? A lot of times people are like,
Thinking, oh my God, right?
Like this, I'm like, I
work.
can't, I don't even feel it, like
Yep.
Jesus. And so, I think that's like super important.
Yeah.
And then from a postpartum standpoint, I mean, it's the same stuff I'm sure that you hear too, but it's like the pain aspect, early pain, like acute pain, swelling pain, that lochia bleeding that,
Yeah.
you never know when it's going to end, tricks you. You think you're done. And then like,
You're not.
2 days later, you get like a blurb that, scooches out and you're like, whoa. Like painful and itchy stitches. I think C-section, just as far as like coughing, like functional activities, as far as like coughing, pooping, lifting up kids in those early stages. I'm talking like fourth trimester,
Yep.
like first 12 weeks, first 6 weeks, like kind of this feeling that you are in an unknown body and that you're just like you're just a passenger in this like new body and you can't figure out how to connect the pieces,
Yeah.
when before it was so easy to just like get out of bed, like you just jump
Right.
out of bed, and now it's like everything takes longer and you
Yeah.
have to kind of figure it out and you have to be like, oh, this isn't like, oh my God, I have this water bed for an abdomen with like a painful, scar, whether it's in your
Yeah.
vagina or in your belly. And like, oh my God, I can't even, like bend down to pick up my bag. Like you don't think about those little everyday things that we take for granted, right?
Yeah.
Just like any surgery.
I love that water bed for a belly. That's actually probably the best analogy I've ever heard. That was good.
Yeah, it's like
it is. It's like
and
you're hollow and it's mushy.
Yeah,
and
you're like
there.
whoa, yeah, and it's like, and then for me, like the cramping after, I had no idea about that. I had no clue about that in all of my training.
There's a lot of stuff that got left out of our training, by the way.
That like, especially when they latch on those first couple of days when they latch on and that like the cramping, like holy baloney. I mean, I had no idea about that. And the night sweats. I had no idea.
That one caught me off guard. That one, when you just wake up in a pool of sweat and you're like, what in God's name? And then you try and go in the shower and then it's Niagara Falls because your nipples are spraying everywhere. Like,
oh my God.
That's the one when I'm going through with pregnant moms. I'm like, okay, so there's literally going to be fluids coming out of every orifice in your body. And then your nipples will be hamburger, yada, yada, But no, that's, it's funny. I try and remember back to, okay, that you hear these things, but you haven't had your kid yet. And I have to believe that I had the blinders on at some point because I know, like when you see somebody else's kid, you're like, oh, we'll never do that with our kid, or, oh, I won't be that. Like, and so I have to believe that we all have that filter that gets, ripped off your face. But like, I feel like the awareness is better now than say maybe, when we both had our kids, but like, how do we get through? Like, how do we encourage moms to seek early education and, get good information instead of being like, oh, I'll figure it out. Women have been doing it for thousands of years. It should be just fine. Like, how do we encourage that?
Yeah, it's a great question. I think there's a couple ways to do it. One, just to kind of speak on that filter kind of thing. I think a lot of times and it's with any unknown, not just pregnancy, but it's with any like, oh, that's not relevant to me because like, like it's not going to happen because we don't have that experience, right? So like we always say like, nah, that doesn't apply to me, right? So I think the shift towards like holistic wellness and prevention will help this cause because there's so much research out there about, what can we do from a prevention standpoint? And PTs really are like the best people to be in this space, right? And if you just look at what we're doing for our orthopedic population in terms of like prevention of ACL ruptures in female
Mhm.
soccer players, and what type of things are we doing to prepare marathon runners so we don't have
Right.
overuse injuries, like all of this shit, right? Like, it doesn't necessarily mean that they're gonna get this type of injury or that they have it, but like, we know that certain populations are at risk for certain things.
Right.
So we need to apply that to pregnancy and postpartum. And I think it comes from two kind of waves. One, I think our medical community, the people that have like kind of first touch for these patients, like the nurse, like the OBGYN community, the midwives, the nurse practitioners, like the people that are seeing them through their conception and through their pregnancy, need to start talking about it earlier and kind of more regularly.
Yep.
And not just referring to providers like us, but providing them like this type of education and being like, okay, it should be mandatory with your like pregnancy appointments.
That checklist, yeah.
That
Like,
checklist,
hey, you're
right.
going to talk to this person, this person. Yeah.
100%.
Yeah.
And is the question like, is it a finance issue? Is it an insurance problem? Because like, what's always the roadblock? Like, well, who's going to pay for that? Right? Like,
Right.
is insurance going to pay for that? Is the hospital going to pay for that? Like, who's going to pay for
Yeah.
that? So that's always a problem. The second thing is, I think social media is really helping with this because people are becoming more open with their own experiences
Yes.
and relating it back to, like the everyday mom, right?
Yep.
It's not like a rare situation where somebody's like, oh my God, I feel like my vagina's falling out, or, oh my God, like I
Exactly.
can't put a tampon in, and people are like, wait, what? And so I think that that's helping. It can hurt also because,
Yeah.
as there's a lot of, a lot of information
Crap.
there that's not, yes. You're much, yes. Trying to be diplomatic.
No, it's crap. It's crap.
There's a
It's
lot
all
of
good.
crap out there.
Yeah.
Yeah. And so I think that can contribute to like some anxiety and some,
Yeah.
fear-based decision making. But I mean, I'm kind of like, at least it's out there, right? And
Mhm.
like, really the goal is to get it out there and to, rip down this curtain of shame about it, and then make sure that people and mamas are going to the right places. And I think
Yeah.
that's the challenge for us as providers. But I mean, I'd rather have more of us out there than not enough.
Yeah. No, I think so too. And it, to look back on just how few providers there were, even just in this area when I first started.
Oh my God. Oh my
The
God.
I could name all of us.
All of them,
like,
right? Right.
in the DC metro area, I could name on like two
Yeah,
hands, and
I
now I'm
know.
like, I used to know everybody, and now I don't.
Great.
So I mean, it's like you said, it's kind of like good news, bad news. Yes, we it's good that there's more access. I think it also brings up the question. I've talked to a lot of people about this, about while we encourage PT, if someone can't access PT for a variety of different reasons, what does that mean? And I think that's where the where you've been doing a great job filling the gap with your programs, providing online education, not only for the postpartum mom, but for the mom kind of trying to learn a little bit more in delivery.
Yeah,
and I think,
sure.
us opening up what PT looks like, and it doesn't have to be dictated by, does insurance cover this, or,
Right.
that sort of thing, but to be able to
Right.
have open access to information. I think that's how it needs to be. And I hope our profession skews better that way, because it doesn't have to be in
One or the other.
Yeah, it doesn't.
Yeah.
I mean, even COVID has shown us,
Yeah.
hey, I can do my job. I can do 97% of my job just like this.
Yeah.
97%.
I know. And it's so interesting too, because I feel like if you had asked me, 5 years ago or
Yeah.
6 years ago, like, would it be successful to do like, a virtual style? I would be like, no, like
I probably would have said the same thing.
Yeah. I'm like,
Yep.
there's no, because like we have no literature behind it. Our experience
Yeah.
is always hands-on, blah, blah. But now, and what I've seen over the past, 10 years in the clinic, and I'm sure you've seen this too, is that like, it seems like there's either an all or none, right? It's either like a mom can come in for therapy or she can't.
Right.
There's no like, there's no like in between, right? And we lose a lot of our clients and our mamas like when maternity leave ends.
Yes.
because they have
That
to
is
go
a
back to work.
huge point. Yep.
They have to go back to work, right? And it's like, okay, so you can either come at 6 in the morning or you can come at 8 o'clock at night or on a Saturday, right? And it's like, we can't do that. So it's either, or it's like, you have to find childcare and you have to, pay the nanny and you have to like bring the kids to the appointments and then you're worried about them screaming around and then you have to go over nap time and then you have to take your PTO and then you have to come at lunch. Like there's all of these barriers in place for moms,
Yes.
right? So it's like, so what happens? It's like you just don't go. I
Right.
mean, I'm like, too hard, not going. Like you can't
Oh,
do it.
no, absolutely.
So
Absolutely.
like, so what's the answer? Like it can't be nothing.
Right.
It can't be like only in the clinic or nothing. So like we have to meet in the middle here. And I think that's what the online stuff is doing. And that was my whole driving force. Like before COVID, I was like, okay, there has to be a way to
Yeah.
take what we're doing in the clinic to reach more people. Because as you know, like we're limited by hours in the day and we're limited by geography.
Yep.
Like I was in Los Angeles. Like if I had a patient in downtown LA coming to the South Bay, even though it's 12 miles, that was an all day
That was a whole day
appointment.
affair. Yeah.
That was a whole
Yeah.
day appointment because it's an hour and a half there, an hour with me, an hour and a half back.
Yeah.
So it's like, you can't fucking do that.
No.
And so I was like, there has to be a way that we can figure out what we're doing in the clinic to like translate it to take those barriers away.
Yeah.
And I started thinking about it before COVID and I just couldn't get it done because I had a 1 and a 3-year-old and I was running my practice and blah, 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 and all the things. And then COVID happened and we moved to the South. And I was like, okay, I closed my practice. I opened the business here in Alabama. And I was like, all right, this is the time. And I'm just going to try it out because there has to be, we have to do better. We just do. Like our profession has to, and we just have to be more accessible.
Well, I think, go ahead.
No, I was going to say, and honestly, Carrie, I think that like moms like it better this way.
Oh my gosh, they're so much happier.
So much
happier. And even just, I have part brick and mortar and part virtual, and even just have the ability to flip flop with that. Like, because let's just be honest, COVID's still here. And a mom's like, oh my gosh, my kid's got COVID. I'm like, how many times are you going to have to put yourself on the back burner? Let's just switch to telehealth. Like
a bajillion.
Right, exactly. And I'm like, let's just switch to telehealth. Let's talk about how we're going to navigate this so you don't fall backwards, because we always put ourselves on the back burner. So, I mean, in that respect, I think the openness to, because you can't physically stand in my office doesn't mean that we can't.
So we can't do anything.
Exactly.
And if we need to go in person, then we will do that.
And we can be super efficient about it too. We know exactly what to do. We don't have to spend all this extraneous time. So you feel that if you went and got a sitter, you went and drove the 3 hours, you got your value.
Just and like boom, boom, boom. And you can do your follow-ups. Totally.
Exactly.
And the thing that's really cool too is that with the hybrid model, or even just with like an all online model, before we would always be like, can't come into therapy until 6 weeks. Right? You can't come in until you've been cleared. But now it's like, okay, let's do a virtual at 1.5 weeks or 2 weeks after you're home. Let's look at your surroundings, right? Because like, what do moms say at 2 weeks? My back is fucking killing me when I put this baby into this bassinet, or when I get up out of my couch, or I can't lift my toddler into the tub.
See it.
You can see. So you can be like, okay, show me.
Yeah.
And you can look at their tub, you can look at their couch, you can look at their toddler, you can problem solve in a way that's like so much more effective, in my opinion, and get them going on early recovery. So when it's 6 weeks, they've already started.
Yep.
They're already halfway there, and they're already like using body mechanics and in the right garment, and they're like feeling better and they're less pain, and then you can like hit the ground running. And we were not doing that in the clinic. There's no way.
No.
Not at 2 weeks.
And to be honest, I mean, and having been a patient myself, like I don't think we're completely honest with what our situations are at home. But when you're in a video and the baby's crying and the toddler's freaking out and dad's nowhere to be found, because inevitably that's the case when you're on a call, like he had to go out and get a coffee during that time. No, but it makes a difference. But like I was going to say, like what you're talking about with LA, where I came from in upstate New York, it was 70 miles to the nearest major hospital.
Oh, Jesus.
So Like, and I'm like, if we can get broadband internet everywhere, like, I don't see why we can't have some degree of group education or whatever. Like, as long as mom
Yeah.
has internet access, like,
100%.
yeah, that should be a thing for
Yeah,
sure.
for
So,
sure. And
yeah.
I think moms like I think what I'm getting from my clients and my moms like that are in the virtual stuff is like this just kind of like collective like sigh
Yeah.
of relief. That's like,
Yeah.
okay, somebody is understanding not only the
Mhm.
physical side and the mental side, but also like just daily lifestyle
Yeah.
demands.
I
And
think that
they're
makes a huge difference.
huge difference. To like, and I have always been the PT. I'm like probably considered like the worst PT in the history of mankind because I like wear heels and I don't run, Harry.
I forgot you wore like crazy, and you're very tall too. How
I
tall are
am, yeah,
you?
6 feet.
Yeah, and you wear heels on top of that. I
I
forgot
do.
all that. Oh,
I know.
I haven't seen you in so long.
I know.
Oh my gosh.
But I've always been like, okay, I'm not gonna just give you a whole bunch of shit to do to like do it, to just do it. Like I'm
Right.
not gonna draw stick
Yeah.
figures or like give you all these annoying handouts
Yeah.
because like I would not do that. Like as a
Bless
client,
you.
like if I was a patient, I'd be like, I'm not doing that. Like,
Right.
sorry. I'd be like, oh yeah, I'm doing my exercises, you know? So
Yeah.
I always tell my moms, I'm like, how much time, like what is realistic for you? I was
Totally.
like, just tell me, like, I don't care. If
Yeah.
you tell me you have 30 seconds a day, tell me you have 30 seconds a day.
Exactly.
Like
Exactly.
if you say I have an hour, I'm gonna be like, great. If you
Bullshit, you do, first
yeah,
of all.
I'm like, how?
I'm like, you don't tell me more.
Yeah, yeah.
Well,
But I mean, if somebody's like, I literally have 4 minutes, I'd be
yeah.
like, okay, this is
Yeah.
what we're gonna do in 4 minutes. And you're gonna
Yeah.
do these 2 things, and that's it. And then they're like, okay, okay,
No,
okay.
my
It's like
mantra
so
is
much.
like, how little do you need to do so no one
Yep.
dies? Like, that's my mom mantra. How little do I need to do so no
Yes.
one dies? And
Yep.
your exercise program will fit into that mantra.
Yes. Yes. And it's all about just like understanding that. And I
Yeah.
think like as healthcare providers, for us to say, like, I understand your
Yes.
lifestyle is huge, right? Because
Yes.
like how many times have you felt as a patient like when you go in and they're like, okay, we're gonna need to do this, not just in PT, but like any sort of appointment where you're like, okay, now I have to fucking do this blood work and now I have to go here
Right.
and I have to make this appointment here and now I have to do
Yep.
it this time. And it's like it just makes you crazy.
Yeah.
And so
Yeah.
like for once, can't we just offer mom something that's like, this is for
You.
you? And it's like whatever you tell me and I will design it around that,
Yeah.
versus
That's
us being
awesome.
like, you must do, 40
Yes.
minutes of bridges.
I've got a couple middle fingers for that.
Yeah. Yeah.
All right. You
Anyway.
talked about activity.
Yeah.
You horseback ride,
I
which
do.
is so cool. And
Thank
you've
you.
gotten back to it more recently since you've settled
Mhm.
in the South.
Yeah.
Talk to me about that, like that whole thing, getting back to that postpartum too. Was that a very
Mm.
different experience? Because there's a lot of core involved in, I'm assuming,
Oh my
in riding a
God.
horse.
Yes, there is. Yes. So yeah, so that was my sport growing up.
No way.
I
That's super cool.
I was what we call a hunter jumper. So I rode horses around like in the arena, jumping over jumps, and I was judged on time and how I looked. It's called equitation, and all the things. And so I did that my whole life. It was what I grew up doing. I loved it. And then senior year of high school, I stopped, went to college. So I basically hadn't ridden in like 20 years.
Oh my gosh.
And I always felt that there was like something in my life that was missing. And I kept trying to fill that void with things that I thought I should be doing. I was like, okay, I'm going to do, I love yoga. And I hate yoga. And I was like, okay, I'm going to do triathlon. And I did one. And then I was like, yeah, I really hate this.
Like
And I
you
remember
don't
like,
run.
no, I don't run. Unless somebody's chasing me. I used to run, but not anymore. And I remember being on my bike training on the triathlon and trying to like get myself through these like hills in San Diego and being like, I'm on a horse right now. I'm on a horse right now. Like my bike is a horse. Like this is a horse. And then, and then grad school and residency and kids. And I was like, yeah, I'm going to do Pilates. And like, I just wasn't happy in anything that I was doing. And going through IVF is like a total mind fuck. And so I just finally felt like I needed to do something, for me. And I just couldn't figure out what that was. And when we moved back to Los Angeles, when the kids were like 1 and 3, I grew up there, and my trainer from my childhood still is there with her barn. And, we keep up on social media, and she's like, "Oh, you're moving back. You should come ride." And I was like, "Oh my God, Devin, I haven't ridden
Yeah.
in 20 years. Like, I think I would die." And she's like, "Just come, just come. Like, you can flat," which means like just ride around, like
Yeah.
jump. She's like, "Just flat a few." And I was like, "All right, fine." And so I did. And as soon as I got on, I was like, I'm never getting off. Like, this is
Oh.
like, this is it. Like, I felt something in me that was like finally complete,
Aw.
And so I like went back into it full time, basically.
Yeah.
Like, Devin was nice enough to let me, come twice a week to the barn and just like ride around the horses that they had there.
Yeah.
And so I did that for about 2 years, like got my sea legs back, like had a couple like peeing situations on the horses that I was very surprised about,
Yeah.
because it's like, it is a lot of core, and it's a lot of like eccentric control.
Yes. I was thinking that
It's
because
like down.
Yes.
That's where I had like my main problems, was like
Yep.
when I was like halting and
Mhm.
like coming down from the jump.
Oh, interesting.
Yeah, super
Okay.
crazy. And I was like, "Oh, weird. I need to start training my pelvic floor
Right?
in this area, like in
Yes.
this eccentric loading." And then, so then we moved to Alabama, and there was a barn, down the road that I started riding. I got connected through some mutual friends. And then when COVID hit, I was like, I'm going to buy a horse. And my husband's like, "You're not buying a horse." And I was like, "Pretty sure I'm going to buy a horse." And he's like, "We're not buying a horse." And I was like, "I'm going to go look at this horse this weekend."
Oh.
And he was like, "Did
We're
you
buying
bring
a
home a
horse.
horse?" And I was like, "Brought him home," like,
Yeah.
so I got him, a year and a half ago, like January.
What's
year and
his
a half
name?
ago. Dante.
Aw.
He's amazing. I love it. I mean, it's just my happy place. So yeah, it's been good. It's been my exercise. It's been, my time away. I started competing again, which is crazy. Like, I never thought I would
That's
do
awesome.
that.
Yeah.
Yeah, it's been wonderful. So
Super cool. And you learned a little
yeah,
bit more about your pelvic floor too.
dude, so intense. Yeah, for
All right,
sure.
if you
I
have
was
horse
like,
problems, call Marcy.
yeah, and I do. It's so funny. I do have some clients who are riders that are moms, and they're like, "What the
Mhm.
hell?" I'm like, "I got you. I know what exercises to do," because
Yeah.
it's so different,
Well, I
But
think that would be one of
yeah,
those things that like you would
yeah,
need to like I try and do as much as I can of whatever activity
yeah,
somebody's doing, but like
for sure.
horseback riding, obviously there's a whole other
Oh my
thing there.
God.
You need a
Yeah,
horse.
yeah. You need.
You need a horse.
I
I'm not
mean,
not
kind
there.
of. Yeah,
But no, I mean, I can
yeah. It's a lot
imagine
of
that. It's
core.
like a whole other
Yeah.
learning
Yeah,
experience.
it's all
Yes.
dynamic, it's
Yeah.
all eccentric. And like, on one of my trainers, who's a dressage trainer, he comes down from Atlanta, and he does clinics, every now and then. So I'll do a lesson with him. And it's all core, and it's
Mhm.
all it's like past midline, like, because you have to
Mm.
like lean back a little bit. And he's like, he's like, "You're a PT. You know what muscle? I don't even know what muscles those are, but you know what you have to do." And I was like, "Ugh." And like, afterwards, I'm just like so sore, because
Yeah.
it's like, if you don't engage them, then you fall off, basically.
Yeah.
So it's like, you have to,
That's why
but
I don't do horses. 'Cause I would fall
you'll be
off.
fine. You'll be fine. But I mean, that's my gym. Like, I don't like to go to the gym. I don't like to lift
Yeah.
weights. Like, I'd rather lift like bales of hay into my
Right.
truck than like, do
Right.
bicep curls. But that's just me. So
Yeah.
it's been great.
Awesome.
It's been great.
Well,
Yeah.
thank you for sharing that. If you want to talk to
Mm.
Marcy, if you want to talk about horses with Marcy,
Horses and
Marcy,
vaginas, my favorite thing.
right? And you've got a couple programs for
I do.
moms in postpartum. Do you mind sharing
Yes.
information on that a little bit? And I'll
Yes,
put your
yes, yes,
IG
yes.
up here for you.
Well, thank you. So I am on Instagram and TikTok as the Down There Doc. Our podcast is No Mama Left Behind _ the podcast on Instagram. My online programs for birth prep and postpartum recovery it's called Down There Done Right. And it is on my website, thedowntheredoc.com. And we just switched platforms. We host the courses in the community on something called Circle, which is awesome.
Cool.
And it's everything all in one. We do our community there. We have discussion boards. We do our one-on-ones there. We do our live Q&As. All the material is there. So if you just head to the website or my Instagram, you'll find all of it. It's super fun, and it's really cool to connect with moms from all over. So
awesome.
yeah.
Well, moms are so glad to. I think everybody's to have an option, I think, is such a blessing at this point, however we got here to this point. And I will vouch you're a blast to work with and just an awesome human being. So.
Oh, likewise. Thanks, Carrie.
Awesome. So much for coming on. If you want to catch Marcy, again, the Down There Doc, she's on Instagram and I think Twitter, or not Twitter, TikTok, the other
TikTok. Yeah. I mean, I dabble. I hang out more on Instagram, but
yeah, me too.
I can only do one.
I know, seriously. All right. Thank you so much for coming on. I appreciate it.
Yeah, of course.